Hello, Miss Bree. My name is Amy. I'm your nursing assistant for today, and I'm here to do perineal care on you. Is that okay? Before I do anything, I'm just gonna wash my hands. I'm gonna give you privacy by pulling the privacy curtain. Let me go get my supplies and I'll be right back. I'm back with my supplies, and as usual, I always arrange them the way I'm gonna use them. So I have a privacy towel. I have the incontinent pad. I always have X6 washcloth, just because. If I don't use it, I'm just gonna dump it in the linen basket. So 2 to 3 washcloth, 6 to 8 more. And then I always have, a battery for the table, because the overbed table, generally for eating. This is a basin with warm water. I already felt it with my wrist or elbow. And then we have soap. So I'm back, and as usual, I'm gonna pick side. So I'm gonna pick this side. I'm gonna pick this side. I'll raise this. Okay, that's because I'm very, very right-handed, and I want to be able to show to the camera the technique I'm going to teach. So again, using proper body mechanics, I'm going to raise the side right. I'm going to move my stuff because I want it close to me. I don't want to lean across the resident. And now I'm going to bring this close to me. Again, when you're doing perineal care, a lot of times you're going to be using a mannequin, not a live actor. So at this time, I'm situated. I've got my gloves in my pocket. I need to raise the bed to mid-thigh or waist level. Using proper body mechanics so I can read the signs on the side rail. I'm going to raise the bed. Okay, the bed is raised to a working level for me. So I look at my table, I see I've got the bath blankets. I'm going to put that on her. Careful not to shake. And as usual, when you have it this way, what you want to do is fan fold the covering underneath. Because I have to keep my patient covered at all times. Alright, so I'm ready to go. I'm ready to work on the perineal area. So this is the time to bring out my gloves. If I wasn't sure, all I need to do is look at my table and I see the incontinent pad, I see the washcloth, I see the basin, so I know I'm ready to work. So you bring out your gloves. So at this time, I need to put this on her. I'm going to have her turn on her side, keeping her covered. I'm going to have my patient turn on her side. I have room to work. Making sure there's enough on both sides. And then I'm going to have her turn back and lay on her side, on her back. Careful not to touch my uniform. And then I have this spread out. So at this time, again, I look at my table. I know I'm ready to wash now. I'm only going to expose the part that I need to work with. take the washcloth, wet it enough, just enough to retain water and make lather with. And now I'm going to put soap on it. You can put soap on each leaflet or just enough on the top leaflet to make lather. Okay, so there's certain things you must say during this skill. Again, it's all about privacy and dignity. So I'm going to go in again with the leaflet method. Okay, making an arrow. I need to verbalize separating the labia. This is the labia. So now I'm going to just do separating the labia, 1. Then I'm going to do the side, 2, 3, separating the labia, 4. And then we already used all those 4 leaflets, so I'm going to turn it, and then to get the groin, 5 and 6. And then now I'm going to rinse. I'm just going to repeat the exact same thing so you get used to it. Again, making 4 leaflets. I'm going to go separating the labia, 1. Go on the side, 2. Go on the other side, 3. Going down the middle again, separating the labia, 4. And then I'm just going to flip it, 5 and 6, 5, 6. And now I'm ready to dry. So I'm going to wipe dry. And just for the purpose of this video, I'm going to do the exact same thing I did with washing and rinsing, so you get used to the technique. So again, leaflets, separating the labia, doing the side of the labia, just the side. And then we're going to go back, separating the labia. And now I'm done with those 4. I'm just going to flip it over. And then 6. So she's been washed, rinsed, and dried. So we're done with this part. I have to get the back, right? So we have to wash both the front and the back. So at this time, I'm going to try and do this. I'm going to flip her on her side. My patient is still centered and aligned at this time. Are you comfortable, ma'am? She says she's comfortable. Are you in pain? She denies it. So I'm going to have my patient go on her side. Like gently under the pillow, covering her up. So I'm working with just the back. So I'm getting water, just like the last time. You never put soap in the water or have soap over the water. You have enough to lather with. And just so you're used to that leaflet method, I'm just going to repeat it here, just so you're used to it. So again, we have 4 leaflets. 1, 2, 3, 4. Flip it over. We're going to do 5 and 6. 5, 6. Now I'm going to rinse. Okay, and I'm just gonna repeat the same thing so you're used to it. A lot of repetition. One, two, three, four, and then 5 and 6. 5, 6. And I'm gonna dry. And again, just so you're used to this style, I'm just gonna do the exact same thing so you know, you kind of remember. Now I could have used a towel and just pat dry, but I'm just gonna do the leaflet method again. So again, making an arrow. Dry 1, pat dry 2, pat dry 3, pat dry 4, pat dry 5, no, that's 5, yeah, and pat dry 6. And we're done here. So what I'm gonna do while I have her there is I'm gonna move, again, careful not to tug, careful not to cause any kind of trauma. This doesn't go in the linen basket, it goes in the trash can. So my patient is, pericare is complete. I'm just gonna close out. So this is the correct method. Put this clothing over her, and then I'm gonna take out the towel. I'm gonna take the bed down. Again, I'm squatting or stooping. I'm just gonna take the bed down using proper body techniques. Okay, bed is down. All this is contaminated now. They all go in the linen hamper. So I need to go on restrain her because we don't want to restrain her. It's a form of abuse. Are you okay, ma'am? I'm just gonna go throughout the water and stow my supplies. I'll be right back. So I'm back, ma'am. You okay? You're fine. Bed is low. Are you in pain, ma'am? She says no. She's comfortable. I'm gonna take out my gloves. Wash my hands and I'm done.